I'm now going to hand over to my other colleagues from Biosciences at Brunel, Professor Amanda Harvey and Dr. Manos Karteris, to talk about the biochemical pathways and more about the placenta and some research that's happening at Brunel. So thank you very much for your attention, and I hope to see you next time on the 2nd of November. Thank you.
Hello. It feels slightly strange saying thank you to a screen, but thank you, Joe. And so for those of you who don't know me, my name's Amanda Harvey, and I'm based in the Biosciences division. I'm a breast cancer biologist by training, and I've been at Brunel since about 2006. I've been asked particularly to talk about vitamins today and how they fit in with fertility and with pregnancy. So the first thing I wanted to do was explain the difference between what a vitamin is and what a hormone is, because we've heard a lot from both Joe and from Sabrina about hormones. And moving on to talk about vitamins, it's important that we understand what the difference is. So both are organic compounds, but vitamins are compounds that are needed in relatively small amounts for normal growth and activity of the body. And the key thing with a vitamin is that they generally are not synthesized by the body. Some need modification when we take them in from our diet, but for the most part, we don't make vitamins ourselves. We have to get them in from our diet. Hormones, similarly, also regulate organ function, but we synthesize these ourselves. So that is a sort of very broad definition, but it gives us something to work with. From a historical perspective, vitamins are not particularly new. We've known about them for well over 100 years now. So in 1905, Fletcher noticed that if people ate unpolished rice, they were less likely to suffer from beriberi. And beriberi is a condition that is characterized by fatigue, by depression, and also by neurological damage. The following year, Hopkins proposed that there were essential nutrients that we got from our diet that were not either proteins, carbohydrates, or lipids. So basically, they're not protein, they're not sugar, they're not fats. And a few years later, it was discovered that, while looking into beriberi, that there was actually an organic compound in unpolished rice, and that's what was preventing the illness. At the time, it was thought that that was an amine, and because it was required, it was termed an essential amine. So vital amine became vitamine, which is what we referred to vitamins as for quite a long time. And Hopkins and Funk together came up with the vitamin hypothesis of deficiency, and they proposed that if you don't have the right amount of vitamins in your diet, then you will suffer with very specific diseases. And those diseases are linked to individual vitamins. Then between sort of 1926 and 1958, more vitamins were identified, and it was at that point that we then realized that they're not all amines. So we needed a second set of names. So vitamine became vitamin. So that's the history in a nutshell, very, very briefly. And thinking about vitamins, and we've heard about supplementation, where do we start? This is just a small example of what is available. It is very difficult to know where to start when you're faced by such an endless choice, and particularly with multivitamins, there's such a combination of things. What do we actually need? So I'm going to focus on not all the vitamins, but the ones that are particularly relevant for conception and for pregnancy, and then make some suggestions at the end around whether or not we should be supplementing. So vitamin A is something we've all heard of. We all know that you have to eat your carrots because otherwise you won't be able to see in the dark. Parents have been telling us that since we were very small. So vitamin A comes from retinol, which you can get directly from meat, or retinol is a breakdown product of beta-carotene. And beta-carotene is the orange thing in fruit and vegetables. So carrots, peppers, squash, anything that's orange is going to have beta-carotene in. And that's what breaks down to then give us retinol. Retinol's required in our rods in our back of our eyes, and they function in low light levels. So, the old wives' tale, if you need your carrots to eat in the dark, there is actually some scientific fact behind that. And vitamin A is quite controversial during pregnancy, because when my mum was pregnant with me, everybody was advised to eat liver because it is rich in iron. Liver is also quite rich in vitamin A. So when I was pregnant with my daughter, we were advised not to eat vitamin A-rich foods because we've just heard about the Hox genes and the fact that we need vitamin A to switch those on. If you have too much vitamin A, then they might not get switched on in the correct orders. More recently, the scientific literature is beginning to suggest that actually the amount of vitamin A that we're likely to have in our bodies during pregnancy is not going to influence that. So we've done a full circle in the last sort of 40 or 50 years on where we stand on high levels of vitamin A during pregnancy. But what we do know about vitamin A is that it's required for lung development of the fetus. And newborn babies that are deficient in vitamin A are also linked to having an increase in infectious diseases. So it certainly plays a role in the development of the immune system in newborns. Vitamin B6 is really important for amino acid metabolism. And when you think about that slide that Jo had up where she was talking about compaction and we went from 1 cell to 2 to 4 to a ball of cells, that rapid amount of cell division happened in a relatively short period of time. And while the body is generating an embryo and a fetus and growing a child, there's a huge level of cell division occurring. So we need high levels of amino acids to support that cell division, and we need high levels of DNA precursors. So vitamins that are important for amino acids production are really important during development. So B6 particularly is important for neural development. It's important for us to be able to produce neurotransmitters. So a lot of neurotransmission occurs through amino acids in the body. So having the right level is really important. And we need vitamin B6 for fetal metabolism. Low levels of B6 have been shown to be linked to reduced levels of conception. So there is an argument to make sure we have good levels of B6 in diets if we're trying to conceive. Most people have heard about folic acid, and Sabrina mentioned that in her talk. Folic acid is really important because it is one of these vitamins that helps in the synthesis of DNA and amino acid precursors. You know, all our cells contain DNA, so if you think of the amount of cells that are going to be produced in developing an embryo and then developing a baby, we really need to make sure that we have the DNA precursors available to be able to cope with that. Deficiencies in folic acid have been linked to neural tube defects. So one of the early stages during development is that the neural tube at the base of the spine forms, and there's a huge amount of cell division that occurs when that happens. So if we're deficient in folic acid, quite often that doesn't happen properly, and that's when we then start to see children that have got neural tube defects. And a lot of countries have a fortification policy, so things like breads and cereals are often supplemented in folic acid. And one of the reasons for that is the window during development where this is really important is often the window where a woman doesn't actually realise that she's pregnant. So unless you're actively planning for pregnancy and actively taking folic acid, it's quite possible that you'd miss being able to supplement in the right window. So a lot of countries now have fortification in foods to try and reduce the level of neural tube defects. Sabrina also mentioned B vitamins linked with folic acid. Vitamin B12 particularly is really important for ensuring the availability of folic acid in the body. So you can take folic acid, but if your vitamin B12 levels are low, the folate is not going to be able to be accessible enough. So it's really important to have that balance. And deficiencies in vitamin B12 have been linked with preeclampsia, low birth weights, and particularly, again, neural tube development, because if we're not releasing the folate properly, then we're not going to be able to maintain that cell division that's required at the base of the spine. Jo mentioned antioxidants. These are really important. They're required to neutralize oxidizing compounds that are in our cells. We have these all the time. So actually making sure generally in normal life that we have a good level of vitamins that are helping to cope with dealing with the oxidants that we're producing is really important. Vitamin C is particularly important for stabilizing collagen. So collagen is produced as strands They align and then they twist together and then they bond. If you don't have vitamin C in your diet, then that bonding doesn't happen. So you then end up with very unstable collagen. And as a result, you can see bruising under the skin. And the classical one is vitamin C defects result in scurvy. So you have inflammation in the gums and potentially swelling in the gums as well, and bleeding. So I said we need vitamins we can only get vitamins from the diet and we don't make any ourselves. Vitamin D is slightly different in as much as we can take in precursors to vitamin D from our diet, but then it needs to undergo a photosynthesis reaction. So exposure to sunlight is quite important for vitamin D. And deficiency is quite common amongst most of the population. And low levels particularly have been linked with postnatal depression. And vitamin D, in addition to regulating some of the Hox genes, is also quite important in regulating the immune system. Joe touched on this as well. It's possible that particularly low levels of vitamin D are associated with recurrent pregnancy loss because those Hox genes aren't being switched on in an appropriate manner. And one of the metabolites of vitamin D is a hormone that regulates the metabolism of calcium and phosphorus. So really, really important in bone development. Another antioxidant vitamin is vitamin E. It protects from lipid damage. It helps to stabilize cell membranes. And it helps to protect our cell structures. So if we have a reasonable level of vitamin E, we're not going to see rupturing of membranes. So helps with maintaining pregnancy, and it's also proposed to protect against preeclampsia. Vitamin K has a role in blood clotting and in bone formation. And most newborns have vitamin K deficiency, so require injections at birth. So logically, you'd think that if we supplemented with vitamin K during pregnancy, we would then alleviate the need to have newborns requiring injections at birth. And actually, that's not the case. Even if you were to supplement pregnant women with vitamin K during pregnancy, that still wouldn't be enough to alleviate the deficiency that newborns have at birth. So they would still require vitamin K injections. So it's quite important to think about, what do we need to supplement and what do we need to get from our diet? And so having heard that, you would think, well, okay, great, off out to get the multivitamins I need, and you count on your hand however many that you need. But actually the literature's a little bit less clear on that. And what it recommends is a list of vitamins that are good for a healthy pregnancy. But actually, in terms of a need for supplementation, the recommendations coming through the literature are that for everybody who is planning on being pregnant or who is pregnant, definitely take folic acid. Everybody should be increasing their dietary intake of vitamin C. But actually, the use of other vitamins as a supplement should be considered in the context of whether or not individuals are actually deficient in them or low in them to start with. So things like vitamin A and vitamin E that are actually fat-soluble vitamins, we store them in our body for a long period of time. So you might be relatively low in them in a diet for a window, but actually you have enough reserves. So supplementation really needs to be based around individuals' diets. So, for example, vitamins where the main sources are meat, dairy, fish products. Somebody who's on a vegetarian or vegan diet is likely to be deficient in those vitamins. So, somebody who's vegan or vegetarian might need to consider having vitamin B12 supplementation during pregnancy, but it doesn't mean that everybody should go out and do that. Most of us probably could do with increasing our vitamin D, but again, that needs to be considered. Vitamin E, vitamin K, again, only those that have a low dietary intake actually require supplements. So the health warning that comes with this short section is that vitamin supplements may not be necessary for all pregnant women, apart from folic acid, which very definitely is. but that individuals really should seek advice and discuss concerns, talk about diet, talk about their own intakes, family history. You know, a lot of you will know whether you have a family history where somebody is deficient in vitamins, and that could be hereditary. So it's something to have a discussion about. But it doesn't mean that everyone needs to go out and raid the local chemists and stock up. So on that note, I will stop.